Cervical cancer is the second most commonly diagnosed cancer in women. Every year, nearly 500,000 women get diagnosed with cancer at different stages. But do you know that cervical cancer can be treated if detected in early stage? About some warning signs. The major warning sign is abnormal vaginal bleeding. That includes postmenopausal bleeding, intermenstrual bleeding, that includes spotting or light bleeding, or bleeding after intercourse. We also see bloating, constipation, nausea, fatigue in women, as well as pain in lower abdomen, pain in back, cramping in lower abdomen. These are the major warning signs. If that includes unwanted weight loss, then women coming across these signs and symptoms must contact a doctor. We also need to speak about some preventive measures and lowering down the risk factors. The major preventive measure that we consider for cervical cancer is HPV vaccine. Why so? Because 90% of women diagnosed with cervical cancer have infection of HPV, that is human papilloma virus. So, vaccination gives us an opportunity to reduce down this infection and preventing occurrence of cervical cancer in future. Along with that, women having multiple vaginal birth are also at risk. So, delaying first intercourse or delaying marriage, delaying first childbirth, reducing down the multiple childbirth also helps us reducing down the number and risk of cervical cancer. Then we know about cervical screening. Cervical screening includes pap smear. Pap smear test is done in women between 20 to 30 years every 3 years. Then it is done every year between 30 to 40 years of age of a woman. It should be repeated after 6 months above that. Why? Pap smear test gives us an idea whether there is any kind of changes regarding dysplasia or precancerous conditions so that a proper investigations can be followed and early diagnosis can be done. Other preventive measures are to keep and maintain a healthy lifestyle that includes avoiding any kind of addictions because addiction, unhealthy lifestyle, low personal and local hygiene moves towards infection or contacting infection. So, I would like to advise all women to be aware of their health as January is considered cervical cancer awareness month and we would like to bring as many as women in this circle so that they can spread the message to other women as well. At DS Research Center, we take a holistic approach towards treating cancer. It includes ancient Ayurveda-based nutrient energy treatment technique along with guidance towards healthy lifestyle and diet. Together, we can make a positive impact and save lives by early intervention and awareness.